this lady has little excess upper eyelid skin, but her lash line is draping down over her pupil. Look up a little bit. It's difficult for her to see because the lash line is draping over the pupil. And we're going to take out that extra skin and raise the lash line like this so she can see. Okay, the first part of the operation is identical to just a blepharoplasty. And we have a pattern design where we're going to be taking out our excess skin. We remove that skin, some of the underlying muscle. We remove some fat if there's an excess. And then the procedure will differ because in this lady we're going to be shortening that muscle that holds up the lash line and impairs her vision. So that will be an added feature in this particular gal. First we remove the extra skin and a little layer of underlying muscle in the center. As I said, this is the same as just with a regular blepharoplasty. And these blepharoplasties can be done in the office under local anesthesia on relatively stoic people and those who prefer to be nice and calm. We offer to do it in the surgery center under sedation. As you can see, it's relatively dry. You don't see a lot of bleeding because before we started we injected some local anesthesia. And we also have an excellent anesthesiologist, Dr. Kevin Becker, who keeps the pressure on the lower side. And these folks tend to bleed very, very little during their operations. The same during a facelift. We hardly get any blood loss during a facelift. Here we have removed the skin, that one little layer of muscle down here in the center. Next, if there's any excess fat, and you can see kind of bulges in the center, we just go in and take out any extra fat that there happens to be. There I've exposed the fat, and I like to remove that with the cautery unit because there again it doesn't bleed. This will make her eyes look less puffy. Now that the fat is out, we pick this up and just dissect down to the little cartilage plate that's in the lid. You can see this little cartilage plate here, and here above it I can see the muscle. And that's the muscle that's stretched out that we have to shorten a little bit. And we do that just by suturing it up on top of the cartilage plate. We grab a piece of that cartilage, take some of the muscle, and you'll see right away how it'll bring the lash line up. So you can see as we shorten it, we'll take a couple of these bites. You can see we've done the muscle shortening now, and you can see the little gap that she has in here. So when she opens her eye, she will not have any ptosis. She won't be covering her pupil, and the rest is just like a regular blepharoplasty. We're just closing the skin. On this side, we've completed the muscle repair and the blepharoplasty. You can see how the lid is up. On this side, we have not done the muscle repair yet. You can see how it's hanging down. She's swollen right now. Once the swelling goes away, this eye will close. Here you can see we're done now. The upper lid skin excess has been removed and the ptosis has been repaired. Another beautiful day at Orange County Plastic Surgery.